What's up, people? This is Super Mom Mitali here, and today we are here in Just Lok Hospital, who is running a special initiative for dengue prevention in pregnant women. So we all have heard about a lot of dengue cases, but I hadn't wondered about what if a pregnant woman catches dengue. So do you want to know more? Let's get ahead in the video, and we have an expert who will tell us everything that we want to know about dengue and its prevention. Hi homies, this is Super Mom Mitali here, and today we are here in Just Lok Hospital. We are here with Dr. Shilpa Agarwal, who is an obstetrician here, and she does something more than that. She also handles all the high risk pregnancy cases, and we'll be talking to her more about what is high risk pregnancy and what does dengue and hepatitis E have to do with it. So, Dr. Shilpa, welcome to Super Mom Mitali, and tell us something more about what is high risk pregnancy and what is dengue.
Hello, I'm Dr. Shilpa Mommies. Yes, Mitali, I deal with high risk pregnancies. That means pregnancy where you have complications like heart disease in pregnancy, like diabetes in pregnancy, like hypertension in pregnancy, and other infections like HIV, malaria, dengue, and other any viral infection in pregnancy. So now, if you ask me what is dengue, since dengue is in epidemic rise, it's not in India, it's worldwide that dengue is on rise. And dengue is actually a viral disease. It is transmitted through mosquito bite. So it is not transmitted by any contact to any person who's infected by dengue, but it is transmitted by mosquito bites, and it's a viral disease. Now, if you ask me what are the symptoms of dengue, the symptoms are basically high grade fever. Any fever which is persistent and more than 100 degrees Celsius, you should always go and meet your physician. The symptoms are mainly fever, rash, can be rash or bleeding from any part of the body, or retroorbital pain. That means pain behind the eyes. So there is a specific pain in dengue which is behind the eyes. Apart from the body ache, myalgia, patient will not feel like doing anything, and fever. So fever is the main component of this disease.
So we've heard about a lot of cases of dengue everywhere, people getting it, but hardly that this came to my mind that what if a pregnant woman gets diagnosed with dengue? She'll get panicked and then she'll run to a physician, and then but she'll run and do everything haywire. But what are the proper steps that a pregnant woman needs to follow? And one more thing is, are pregnant women more predisposed to having or catching dengue?
Yes, a severe form of dengue is more prevalent in pregnancy because pregnancy is immunity suppressed problem. In pregnancy, the immunity is low. So the female is at a more risk of having a severe form of disease. So per se, it is not a high predisposing factor. Now coming to the important steps. First of all, please do not panic. Dengue is not something which is a very severe problem. It can be tackled with proper monitoring and care. So the first thing you should do with any fever in pregnancy, go to your physician. Okay, we should not monitor it at home and see that if it will settle, then I will not go. Okay, so they should visit their physician. Please check it out that it's a normal fever and nothing else. So if you are sure that okay, I'm not dealing with anything else, then if after you visit a physician, the steps are diagnosis and monitoring. The treatment of dengue is simple paracetamol. So you don't have to give any antibiotics for dengue since it's a viral disease and not a bacterial disease. And the mainstay is adequate hydration. Plenty of fluids in any form is a must in dengue fever. So as I said, early diagnosis, plenty of fluids, and prevention of any complications, and paracetamol. So fever we should avoid. Having fever is more dangerous than thinking about the effects of paracetamol on pregnancy. So please do not feel that paracetamol is going to cause me problem, but it is fever which is going to cause you problem. So please, you should not avoid paracetamol and let the fever be under control with around the clock paracetamol to you. You can take up to maximum 4 grams of paracetamol per day. So that means 8 tablets of paracetamol you can consume per day safely if need arises. Okay.
So, ma'am, what are the severe forms of dengue, and does dengue affect the unborn baby also?
Dengue can rise from one form to another. You can have a simpler form, which is a mild dengue fever, or a dengue shock syndrome where the patient will go into shock, or a dengue hemorrhagic fever where the patient will have bleeding complication. So mild dengue, dengue hemorrhagic fever, or dengue shock syndrome. But usually, most of the times, we are fortunate that the outcome is good, and in only 5% of cases it goes to a severe form. Okay, now for your next question, which is how it affects the baby. It depends on two factors. One is in what gestational age of pregnancy she is, like whether she is first 3 months, or in the middle months, or in the end of the pregnancy, and also how severe is the dengue. If it's very severe form, it can affect at any stage of pregnancy. So we do not wish to have any severe form of dengue at any stage. It can have bad effects on the fetus. But now milder dengue, if it's in the first 3 months of pregnancy, it can cause miscarriage. If it's in the middle months of pregnancy, it can lead to premature delivery. Or there are cases which have shown that it can lead to high blood pressure. And if it's in the last 3 months of pregnancy, we have to make sure that we delay the delivery if at all possible, because the protective antibodies will go from the mother to the fetus. So we want that the fetus should be protected with the antibodies. So if the delivery is at the acute phase of dengue, there can be a vertical transmission, by which I mean the dengue fever, the dengue virus is transmitted from the mother to the baby. But that happens only if the delivery occurs at an acute stage of disease, where we have to monitor the baby for any dengue features.
Ma'am, how can we prevent dengue? I mean, not only for pregnant women, but also for kids, adults, everyone.
See, either we can change the surroundings or we can change ourselves. Now, if we see the change of surroundings, we mean that we should avoid any stagnant water. See, dengue mosquito, they breed in clean water. That should be understood. That is, they breed in clean and stagnant water. So, any water which is collected around your house in like pots, vases, or any tires which they usually see, if they are filled, they should be emptied. So there should be no water collection around your house, especially in rainy season. The potholes, the drains should be covered. So you should take care of the surroundings as well. Now coming to your own self, always air conditioning is what prevents mosquito bites, because they breed in warm atmosphere. So being indoors and keeping the AC on if possible is a very good prevention from mosquito bites. Secondly, wearing long sleeve clothes, wearing protective clothes like wearing socks, wearing long sleeves, track pants also prevents dengue. Now next is mosquito repellents. See, I feel the mosquito repellents, as far as possible, they are safe in pregnancy. They should not be worried about using it. But yes, for the kids, little bit reluctant. Try and give them protective clothing first. Use natural essential oils like your eucalyptus oil or citronella oil. You have many brands available with the bands and the patches which they can use. And also the creams the mothers can apply on themselves. Less than 2 months, they say please do not use any creams or repellents for a less than 2-month-old baby. But above 2 months, you can use all the repellents and creams. But you should take care that you are using other methods first and then go on to your repellents and insecticides. Because yes, obviously, if they are insecticides, so definitely some chemicals are there. But the studies have found that they are safe in pregnancy and can be used by a pregnant mother.
Dr. Shilpa, thank you so much for giving us so much information about dengue and how it is a high risk in pregnancy. And this is a special initiative by Just Look Hospital on dengue prevention and how it can be a high risk for pregnant mommies. So, pregnant mommies, if you have dengue, do not panic. If you want Dr. Shilpa to answer any questions related to this, do let us know in the comment section below, and I will make sure that she personally answers all the questions. So, how did you like this tag? Do not forget to let us know in the comment section below. Give it a thumbs up, like it, and increase our mommy community by subscribing. So, it is bye bye from me, Sup Mom Mitali. Bye bye from Dr. Shilpa also. And keep on rocking. Make sure that you don't catch dengue.